In today's presentation, we will be presenting the topic Pollution's Effect on Childhood Asthma. This presentation is presented by
Hi, my name is Karen Perez.
Monique Valderas,
and Nafpreet Kaur.
We decided to conduct further research on this particular topic since there's a staggering amount of children in the Central Valley visiting the ED for respiratory-related issues. After going further with our research and getting a different perspective on data, we realized that our gap was to question why this occurs in the San Joaquin Valley. The unique factors that the Central Valley has really contribute to understanding why there are a lot of minors attending the ED for respiratory issues. The agriculture industry alone brings in two of the worst greenhouse gases, nitrous oxide and methane. Because of these factors, we believe that by studying the effects of said greenhouse gases on air quality time, we can help determine the effects of poor air quality on human health. Also, the valley is in a bowl-like environment which traps in the air and the harmful gases that comes along with it. We can reach a conclusion as to why there is such an extreme rate of childhood asthma in the valley in comparison to the rest of the state. For our research question and the question to clarify the purpose of our presentation, we decided to ask, how does pollution affect the respiratory health of children within the San Joaquin Valley? In order to answer this research question, we used the asthma ED visit rates data from children 18 and under in the San Joaquin Valley to represent those who are affected by the respiratory health. We went ahead and used the air quality data points from the San Joaquin Council of Government Annual Air Quality Index. To keep the data more accurate, we extracted certain counties to ensure that the same counties were being compared. We also had to go through the data and find the averages of every county to make sure there was no repetitive data. After this, the data was averaged once more to find the yearly rates overall.
This graph represents the average amount of visits from 2011 to 2016 where children had to visit the ED due to their issues regarding their respiratory health. The x-axis shows the years as a timeline, and the y-axis shows the yearly ED rates per 10,000 residents. As we look at the graph, we can see a peak of patients during the year of 2012, which is due to the Tulare County having very high rates at the time. So when averaging the data, Tulare County could have thrown the average off. Despite the variation of values, we can see that as time goes on, asthma-related visits to ED are rising. This graph represents the ground level ozone versus the year 2011 to 2016. The x-axis have the years to provide the timeline, and the y-axis shows the ground level ozone percent. Ground level ozone is a pollutant, and it is formed when heat and sunlight allow the reaction of two other pollutants, nitrogen oxide and volatile organic compounds. We can conclude from the graph that as time goes on, the ground level ozone tends to increase as well.
When we overlap our data to see if there's any correlation between how much pollutant there is and how many kids are going to the infirmary for respiratory related issues, we can see that there is in fact a correlation. In this graph, we have our ground level ozone, our pollutant, as the x-axis, since it's a variable we suspect has the influence over the y-axis, which is the ED visit rates. From this graph, we concluded that the amount of children going to the ED and the amount of pollutant present have a proportional relationship. As pollutant rises, so does the amount of children going to the ED for respiratory related issues. As stated earlier, children in the San Joaquin Valley are at risk of having respiratory-related issues more than the average Californian resident. This is due to the valley having higher amounts of concentrated pollution, which could be caused by the huge agricultural business residing in it, which releases pollutants like nitrous oxide and methane. We hope our research makes those who want to industrialize the valley even further to stop and think what the risks are. There are children suffering unnecessarily just because they were born in the San Joaquin Valley. We would like a moment to thank these resources for providing us with the information needed for this presentation.